Assessment surgery. The 21st of July will be the day of the resubmission for those who didn't pass the first time. The essay is a 1,000-word reflective piece. There's a template provided in the module site. Take the opportunity to use that template and the rubric. The rubric will help you to guide your writing as well. If you still have questions after this session, use the discussion board to write those questions. When you're thinking about your reflective piece, what we want you to do is always to remember that it has to relate to your activity. Or whether that was alcohol or tobacco or vaccines, it needs to be related to your activity. So one thing you need to think about is, was the activity useful to think about the opportunities and the challenges of tackling the problem as a global health problem? Was the activity useful for you to think about other global health problems and how those relate to inequalities, how those relate to the challenges of global health inequalities? And also to think about this in relation to culture. And by culture, we're talking about context. What is done in one country, as opposed to what is done in another, and the reasons for why this is done. Usually that relates to their context, but also to the culture within that area. Another thing you need to think about always, and we are giving you 100 words for that, it's how your activity relates to the NMC code. We'll talk about that again at the end, when we talk about the themes of the NMC code, which you need to include. Another thing which you want to think about is, when you were doing your activity, was it easy to do the task? Was it challenging, and what was challenging about it? And how all of this ties in, again, to the NMC code. You're going to be nurses in a few months, so we like to keep repeating to you that whatever you do, you need to relate it to yourself as a nurse and how it relates to your code. So the first part, if you look at the template, it has a section which we call activity. Just copy and paste whatever the title of your activity was into this section. Or don't change the words, just copy and paste that title in there. In the second part, you start to use the Rolf model. The first part of this model is the what. In this part, we want to talk about what activity you chose. Describe the activity, what exactly you did in your week 2. Describe what you examined within that activity. Talk about what you learned, what you plan to learn. Remember in week 1, and again in week 2 in your activity, we reminded you to set up your own learning needs. So that's your opportunity to say what exactly you hope to learn within this activity. And for you to do that, you need to consider what your understanding was of that problem. Whether it was alcohol or tobacco or vaccines, what your understanding was, and what gap you hope to close up by doing this activity. For the next section is the so what section. We're giving you a few more words here. And the reason for doing that is, this takes care of your learning outcomes 1 and 2. So think about using about 300 words to 400 words here. And this is your opportunity to talk about all you have learned in week 1 and week 2. How does the activity relate to the wider determinants of health? How does it relate to the global patterns of disease? A good example is to think about what laws exist in one country as opposed to another, how the disease is in one country as opposed to another. So let's say you are looking at alcohol. What is the burden of alcohol in Scotland or in the UK compared to elsewhere? What are the policies in the UK compared to elsewhere? And you have to think about that culturally as well. What exactly is the policy in one country as opposed to another, and how the culture relates to all of that? And then you need to tell us about how it relates to the principles of global citizenship. Remember, I should have said it before, but you need to be writing in the first person. And when you are writing, it is not just your opinion. Use the references to support whatever you say. In the next part, which is in the now what part of your Rolf model, we'll be looking at appraising and at the impacts or the actions of change. So what do you expect to change in your practice? And if you look at the learning outcomes 4 and 5, it talks about effective teamwork, shared decision-making, the use of health information materials suitable to the different groups in the communities. So, this is the opportunity for you to bring in those cultural aspects and your work as a nurse. It's your opportunity to think about how you want to change things in practice, or because you're graduating, you're thinking about moving, let's say, for example, into research and working on that problem. Or you are thinking of moving into advocacy for policy, so these are just broad ideas which I'm throwing out at you, and things you should think about on how to write. How would you advocate change? Or rather, how you would want to change in practice or in policy or in research. The next thing which I want you to look at is about teamwork and shared decision-making. For that, it's not only about yourself as a nurse, but think about how you interact with your patients, but also how you interact with your colleagues, and how you can get that change to happen. We talked about using the first person and the academic literature. For the last part, we're giving you a nice 100 words at least for you to focus on the NMC code. So there are broad themes in the NMC code, and we have listed them here about prioritizing people, practicing effectively, preserving safety, and promoting professionalism and trust. But there are also sub-themes, which 2 themes you want to work on, and you don't need to choose the broad themes. You can choose the sub-themes within the NMC code that you wish to relate to your activity and to what you learned from the activity. Critically interpreting is what we are talking about, which means to delve into a lot of details about this. Before we use the words appraise, describe, explain, and examine. There is another slide in which I'll remind you of these words, but remember you did that in Task 1. So it's an opportunity for you to go back to what you did in the lecture of Task 1 and try to remind yourself. I cannot reiterate enough the importance for you to use the first person. It is a reflective essay, therefore, we don't expect you to use the we you would use in a research. Instead, you need to use I, because it is your work, it is you talking about the activity, you're reflecting on your activity. In Task 1, we talked about the meaning of the verbs describe, explain, analyze, discuss, appraise, or explain. Appraise we have used for the now what section, and we have also used critically explained. So when we talk about that, your critical explanation, or your critical evaluation, we are asking you to make a clear justification. For every statement that you make, you need to justify it, provide reasons for why you are making that statement. When we talk about explain, examine, analyze, and discuss, we want you to go into depth of that topic, and you need to do a for and an against, and when you're doing this, remember when we talked about critical thinking in Task 3, we told you about the need to always look for evidence to support what you're saying. So if you say something for, then you need to look for evidence to support it, and when you say something against, you also need to look for evidence to support it. And that allows you to delve deeply into the topic that you are discussing. Describe, it's going to be basically what happens. So in the what part, we want you to describe. So basically, you'll be telling us what you did in your activity as it happened. Questions time. The difference with previous reflective essays, this time we want you to focus more globally. A lot of times, people forget about the activity and they do not write in relation to the activity. Whatever you're talking about, it must be related to your activity. The next thing you need to do, because this is a global health module, you need to be thinking about the inequalities related to different areas, not just to Scotland. How would you approach the problem to make an impact, or to advocate a change, or ensure that a change occurs, not just within Scotland, but globally? How are the policies different globally, between countries, and why are there these differences? And what it would mean for you as a nurse if you should make a patient globally? These last words do not make any sense, but the lecturer exactly said it in this way, probably confused while reading a question. Think global, not just in your local area. A student raised the concern that there's no many words allowed to describe the activity in the what section. So the lecturer answered that we don't need to go into every detail of the activity. It's an overview of what you did in the activity. And in that section, you also want to be thinking about what you hope to learn from the activity, and maybe why you chose that particular activity. Then, the so what section is about your learning. You can mention the activity in that section, but you cannot explain what the activity is. The other lecturer said, your so what section is where you would be relating your activity with your wider determinants of health. It's where we talk about learning outcome 1 and learning outcome 2. Check these two fellas, please, Sam. So, it's not a place to describe the activity, but to relate what you learnt to the wider determinants of health and global citizenship. Another student raised the problem of talking about the two themes of the NMC code in 100 words, which seems to be not many words, so the lecturer suggested that we could divide the two themes 50/50ths and try to explain how what you did relates to your NMC code. The other lecturer said that we cannot just mention the two themes, we have to explain why they relate to what we did in the activity. A student said, I'm struggling a bit with the wider determinants part. The lecturer answered, it's important to remember that it's not just what you did in the actual activity, it's also the week 2 learning, the preparatory learning that you did before attending the session. And have a look back at week 1 learning as well, and see what links you can make there. Another student asked, are we treating the NMC part as conclusion, so no new references, and concluding the piece of writing phrase not really nicely written, I think? The lecturer answered, in this case, no. It's not a typical conclusion, it's kind of a separate section of the template, and you do need to reference the NMC code in that part, and make sure you do that. It's not a typical essay because of its template with the different sections. It might be worth having a look back at your essays 1 and 2 to see what you did there, and any feedback that you got on that. The other professor added, yes, definitely. Use particularly the feedback from the essay 2, which had a similar template to this one. A student said, I think it's difficult when it's our reflection, but we are writing about health outcomes globally, which takes up a lot of our word allowance. Lecturer, I think it's important to keep in mind that what you're writing about, even when you're writing about the health outcomes, globally, is your learning, so you don't need to go into a huge amount of detail, again, about the health outcomes globally. You are thinking about what have you learned to do with that from your activity and the preparatory learning and the week 1 learning. So all of that is part of your reflection rather than it being a separate kind of aspect. It's you thinking about what have you learned about this and thinking about it in a global health outcomes kind of context. But make sure you're reflecting on your learning. Does that make sense? Another student says, for now what part, it needs to include health information materials and their suitability for different groups and communities. For instance, provide leaflets about alcohol use. How would you assist a patient from a different culture in understanding the content? Professor said, I would say that is definitely good to think about because we obviously have our kind of standardized leaflets for alcohol use, but you do want to think about how you can assess patients from different cultures in understanding the content. And definitely something if you wanted to have a look into that for your essay and include that as some of your learning, and you can relate that back to the global context as well. Professor said, what do you guys should do in regard to the so what aspect is, when you're writing about the wider determinants, it's across the board. It doesn't matter what area you come from, there may be differences, but highlight one or two differences that exist globally in one area compared to another. In the group that had the alcohol activity, there was a comparison between the UK and Afghanistan, I think, so think about things like that. We are not expecting you to give us 100 examples in different countries. You meet patients from different walks of life, you can meet patients from different cultures, so try to bring in some of that thinking, and try to bring in some of what you learned in PASC 3, where you guys have learned about cultural competence. The other professor said, I'm not sure that was in PASC 3, but it definitely sounds relevant. The previous professor said, so it may be worthwhile to look at those lectures and see what you can get from them, and particularly the references and how they can relate to your activity. One student asked, what about for so what? Do I need to speak about different countries, or can I speak about sustainable goals about alcohol? The professor answered, both of them sound very relevant, but I know the word count is quite tight, so you might not be able to do both, but it's really reflecting on your learning. So what? What do you feel you learn from taking part in that activity and all the kind of related learning to do with it? That's what you want to write about. But both the suggestions there would make sense. The other professor said, dear student, you don't have to do both. You can choose to do one of them. I don't think you'll have the space to talk about both. The end.